So I think what was great when I came is that we saw people coming through that were from all kinds of backgrounds and communities. I know certainly from my own community as a West Indian or Black African community, there has been a bit of hesitancy and a bit of concern. And I guess it's not even hesitancy, it's about confidence, isn't it? And some of the work that we are doing here, I think, is trying to just provide that confidence. How has it been from your end?
No, I think that's a really, really important point, and thank you for raising it. I mean, I think initially, as with a lot of things, I can totally understand there were a few anxieties that were kind of brought forward to us, particularly from patients coming down. It did seem like there were certain communities out there with certain information that maybe got out, which had naturally worried people about the contents of the vaccine and potentially some of the side effects it could have. That's something very much on the front line we were experiencing. We were getting asked a lot of questions. I think as it's gone along, actually, and particularly as people have been talking about positive experiences, but actually from a medical perspective, as we've been seeing actually what the side effects have been, people have been getting more and more confident, actually, which has been lovely to see. So just to put it in perspective, we've done several thousand of these in these centres, in our own surgeries as well, in care homes and for housebound patients. And I probably actually couldn't tell you of one serious adverse reaction that we've had from the vaccine immediately afterwards. And that in itself promotes a lot of confidence. Just to put it on a wider scale, I was actually speaking to a paramedic colleague of ours who's been in centres everywhere for several months. He's obviously seen far more vaccines than me even being done. And he said he could probably count on one hand the number of actually serious reactions that have been had. And it supports the national data and really means that we can with quite clear confidence say to people that this vaccine is as safe as any of the other vaccines out there, which is obviously a lovely outcome.
Absolutely, and I think that for me that's what I'd share with our communities, that we're a long way down from that beginning, and as you said, millions of doses now being given out locally, thousands upon thousands of doses being given out. So I feel that we can confidently speak to our communities and say, this is the way. This is protect yourself, protect others. I phoned my mom and my dad and I told them, make sure you're vaccinated, and I've got my assurance back from them that they have been. So, I think the work that we're doing here is really one of huge protection and huge significance for our families. So, if people, one question I was going to ask is, and you mentioned it, which was, when people are nervous, how do you talk to them, and where do they go when you've spoken to them?
So, I mean, so generally speaking, we've actually found there's been a lot of merit in just actually speaking to them directly as their GP. And often if you've kind of fostered that relationship with them over several years, we have found that actually having that trust kind of embedding or in the background to such a conversation has been very helpful. So normally we would just explore the reasons for their anxieties, maybe what exactly they're maybe anxious or nervous about, because then we can specifically give the relevant advice to them and maybe relevant reassurance. After the event, absolutely, we have had several patients calling back to us. So it's generally coming to the GPs or the nurses or the clinicians that have given the vaccinations and have quite a good knowledge about it now, if we want to allay any concerns or actually speak to them about anything. Or indeed, if we feel we need to seek further advice, we've always been supported very, very very, very quickly actually, and in a timely manner by the CCG and other sort of members of the overall screening programme. So there's always been plenty of people we can ask for further advice if we need to be. But the first port of call is generally sort of the GP when they come back to us.
So if people are nervous, you're fine with them asking you the questions?
Absolutely. We'd much rather actually that people feel comfortable and ask the questions up front and give that initial reassurance so they feel comfortable getting the vaccination, rather than not feeling so comfortable and then maybe having one or two things that they're not sure about afterwards. So we'd much rather give that advice up front.
Great.